a groundbreaking report shines a stark light on the critical issue of data recording discrepancies concerning biological sex and gender identity, highlighting significant risks within healthcare and safeguarding systems. The comprehensive review, spearheaded by Professor Alice Sullivan, a distinguished sociologist and research specialist at University College London, UCL, reveals a concerning lack of clarity in current data collection practices. This oversight poses substantial challenges to effective service delivery and individual well-being, demanding immediate and decisive action. The report, commissioned over a year ago by the Conservative government with an initial August deadline, has finally been released following the recent election. This delay underscores the urgency and complexity of the issues it addresses. Professor Sullivan's meticulous research exposes the far-reaching consequences of failing to accurately and distinctly record both biological sex and gender identity. The consequences extend beyond mere administrative inconvenience. They directly impact the safety and efficacy of healthcare, social services, and legal protections. The report meticulously details the numerous instances where ambiguous or conflicting data have led to misdiagnosis, inappropriate treatment, and compromised safeguarding measures. For instance, in healthcare settings, inaccurate sex assignment can result in ineffective medical interventions, delayed diagnoses, and even life-threatening errors. Similarly, the failure to adequately record gender identity can lead to inappropriate placement within support services, increased vulnerability to discrimination, and a breakdown of trust between individuals and service providers. The repercussions within safeguarding contexts are equally profound. Incorrect or incomplete information can severely hinder efforts to protect vulnerable individuals, particularly children and adults at risk of abuse or exploitation. The lack of clear, consistent data poses significant obstacles to effective risk assessment, intervention strategies, and the overall effectiveness of safeguarding frameworks. The report emphasizes the need for a standardized, comprehensive approach to data recording that respects individual autonomy while prioritizing safety and well-being. Professor Sullivan's recommendations are clear and impactful. A fundamental overhaul of current guidance is necessary to establish a system that meticulously differentiates between biological sex and gender identity. This includes the development of clear protocols, robust training for data collectors, and the implementation of technology that facilitates accurate and secure data management. The report advocates for a multifaceted strategy, incorporating input from healthcare professionals, social workers, legal experts, and, crucially, the transgender and gender nonconforming community themselves. Their lived experiences are invaluable in shaping a system that is both accurate and respectful. The Department for Health's response underscores the gravity of the situation. A spokesperson stated, "This report contains serious, new findings that demand urgent investigation and action. The department will address these issues with the utmost seriousness as we undertake a comprehensive reform of gender identity services across the board." This commitment is essential, signaling a move towards a more inclusive and effective approach to data management that ultimately protects and empowers individuals. The report serves as a wake-up call, urging immediate action to rectify these critical data discrepancies and ensure that all individuals receive the appropriate care and support. The future success of healthcare and safeguarding systems depends on the prompt and comprehensive implementation of Professor Sullivan's recommendations. The time for decisive action is now. The stakes are simply too high to ignore.